Your Excellency, the Honorable Minister of Health of Uganda, Dr. Jane Ochero, Excellencies, ambassadors, representatives of partner and community organizations, donor agencies, colleagues from WHO, distinguished guests, ladies and gentlemen, a very happy new year to you all. It gives me great pleasure to join you today on this landmark event for people's health. Though regrettably I couldn't be in Mubende district physically, rest assured of my full support. Today, we join the government of Uganda to declare the end of the Sudan Ebola virus outbreak in the country less than 4 months after the first case was confirmed in the central district of Mubende on the 20th of September 2022. In line with WHO recommendations, the country is having passed 42 days since the last case paves the way for the declaration of the outbreak's end. After the announcement of the Ebola outbreak on 20 September 2022, the Ministry of Health, with support from WHO and partners, initiated a fully fledged response plan to contain the disease rapidly. Your Excellency, I wish to commend the role of the President, His Excellency General Yoweri Museveni. His efforts highlighted the critical importance of high-level political engagement in epidemic and emergency preparedness and response. I equally thank you and your team and other sectors of government for your remarkable leadership and action in responding to a complex outbreak. With no vaccines and therapeutics, this was a challenging Ebola outbreak in the current context, but Uganda stayed on course and continuously fine-tuned its response. As the world's leading public health agency and working across the country, regional and global levels, we provided technical and operational support. We deployed the tools needed for a successful response. With the help of donors, we devoted a total of $6.5 million from the WHO Contingency Fund for Emergencies for the response in Uganda and another $3 million to support readiness in the 6 neighboring countries. We worked closely with the Africa CDC and Ministries of Health in the highest at-risk neighboring countries to establish a regional Ebola task force that coordinated readiness efforts and facilitated information sharing across the countries. Soon after Uganda declared the Sudan Ebola virus outbreak, we worked with vaccine developers, donors, and the Ugandan health authorities to identify candidate therapeutics and vaccines for inclusion in trials. 3 candidate vaccines were identified, and the first doses arrived in the country on the 8th of December 2022, constituting an historic milestone in the global capacity to respond to outbreaks and prevent them from becoming pandemics. Our team helped design the trial protocols and trained 200 members of locally led research teams on conducting the trial according to strict international standards. My sincere appreciation goes to the health staff who saved the lives of 87 survivors by offering supportive care. I express my sincere condolences to the families who lost loved ones to this outbreak and the 7 health workers who died in the line of duty. As the outbreak officially ends today, it's essential that we review the response and lessons we learned for future outbreaks. The key role that communities play was amply demonstrated in this response and its initial challenges. We also saw the need to engage the entire health system, including the private sector. We're working with the Ministry of Health to plan an after-action review in this regard. One of the key features of this response was a collaboration with various institutions and mobilizing capacities across the board. Over the next 6 months, we'll be harnessing these lessons to inform our focus on health promotion and disease prevention. Close follow-up of survivors to ensure they are well integrated back into society will remain a priority. Honorable Minister, partners and colleagues, congratulations once again on this great achievement. Thank you.